Welcome back to San Antonio Living. You know, the weather's warming up. We're starting to wear shorts. And what if you've got unsightly varicose veins that you're dealing with? We've got something that can help you take care of that in time for the spring. Dr. Jeffrey Martinez is here, and Grady Adams is one of his patients. Thank you both for coming this morning.
Thanks for having us.
You know, I've seen some serious varicose veins. A lot of the time, I've talked to women about varicose veins. So I'm glad that you brought Grady with you, because it's not just women that suffer from varicose veins, right? It's both.
That's right. We see it in both males and females. Females are more predisposed to having varicose veins, so that's the more common scenario. It also tends to arise more in pregnancies, so therefore we see it more in women. But men can have it, and they can be equally as plagued by the varicose veins.
Grady, let's talk about your situation. You had them down by your ankle.
Yes.
What was the problem for you? Was it the fact that they didn't look very nice, or were you having pain too?
No, it was pain. I had phlebitis when I was in college. Intramural football, I got hit on my left thigh, deep thigh bruise. 30 years later, it developed into an ulcer, and it was painful. And I was not treating it as much, but I was, Dr. Martinez was recommended for the tissue treatment, they originally called it.
Well, let's talk about that. Varicose veins can lead to bigger problems like ulcers.
Right.
How does that happen?
Well, probably it's estimated somewhere that more than 10% of the population are affected by varicose veins or venous disease, and probably 3% of the population is affected by really serious varicose vein problems. That being ulcers. Sometimes it can be skin changes, but ulceration is really the worst that we see. And Grady here had that, and as a direct result of that.
So it's not just for appearance. A lot of people are having health-related problems because of these varicose veins, but there's a procedure that you can do to get rid of them for good. I mean, you're not going to have the big bulges. You're not going to have the pain, and the procedure has really changed drastically over the last couple of years. How is it done now?
Right. So now we're using, it used to be where we strip the veins, but now we're using radio frequency or laser treatment. And in this cartoon video, you can see we take and pass a catheter just through a needle stick into that vein directly, and we advance that through the vein just under some local anesthetic, and we withdraw that catheter back over time, and that causes a thermal injury or like a little microwave inside of the vein to seal the vein off from the inside out.
So Grady, anybody watching wants to know, did it hurt? You know?
Surprisingly, no.
Okay.
And I'm not a big fan of needles. So,
and
but no.
you did it just fine.
Yes.
Well, I want to show some before and after pictures, because everyone's got sort of a different situation when it comes to their varicose veins. What's happening here?
So this is the advanced disease that we see with venous disease. This is an ulceration at the ankle area. It's a very common area for it to occur.
A big difference.
Also on the inside, and after we've treated the varicose veins, they've healed.
Okay.
Kind of the natural history of these is that they will break down, heal, break down, heal, break down, and usually they tend to get harder to heal with each session. So
that's a big difference.
Once we treat those veins, we can get them to heal up.
And we've got one more before and after. These are some of the more common pictures of varicose veins, the big bulgy things that no one likes to look at. Look at that. You can take care of it. That's pretty amazing. Now, what about recovery time and how long people have to be off once they have the procedure?
Yeah, so the best thing about this procedure is that there's very little downtime.
Okay.
So people walk in the office, they walk out of the office, they can carry on their regular activities. They generally have a support stocking in place that needs to stay in place for a period of time, but their usual activities they can continue.
And how are you feeling now, Grady?
100% better, different world.
I bet. Well, thank you both for coming this morning. I know that if you're watching at home and you saw some of those pictures, they remind you of something that you have. You definitely want to take advantage, because you've got a special offer for the San Antonio Living viewers. The first 10 callers are going to get $200 off their initial cosmetic procedure, and that's for new patients only at Veintec Varicose Vein Clinics. Now, there are 2 locations. They're both on your screen right there. And if you've got questions, give them a call. Mention San Antonio Living. They'll tell you everything you need to know at 866-570-6584. You can also check Veintec.com for more information.